Hi, I'm Daniel Ruyonga. I'm the CEO of Teheca. Teheca is an online platform that focuses at reducing high mortality rates among newborn babies and mothers in developing countries. Teheca is a startup in Uganda, and we've been in existence for the last 2 years. In the last 2 years, we have taken several strides forward. We can say we started as a patient care company, but we've evolved to focus more on postnatal care, looking at the challenges within the postnatal, challenges in maternal health, and we believe we have the potential of making a big impact within that field. Back in 2015, when the idea of Teheca came up, it came up from one of our founder's mother. She was a midwife, I would say, working with NGOs and working as an in-home nurse. Even after she retired, there were people who still call upon her to offer in-home services. She talked to us about that, and we said maybe we could make this, there could be more people who don't know that they can have these services within their homes. So we developed a Teheca concept around there, having in-home care for each individual. Individuals are unique, and each of them need special care. Based on that, we came up with the Teheca concept. But as we evolved, we realized that there is a big gap when it comes to postnatal care services. We looked at the fact that we have high mortality rates, especially in sub-Saharan Africa. We have health workers who could easily avail to mothers in hard-to-reach areas as well as in-home. From the concept of in-home patient care, offering personalized care, we evolved to be able to offer in-home postnatal care services. The focus here is to ensure that we reduce the high mortality rates of mothers who are dying. There's a UN report that stated that over 1.16 million newborn babies die within the first 8 days of birth due to after-birth related complications. We saw this as a challenge that we as Teheca could take upon and be able to use low-cost, low-tech solutions like SMSs to be able to reach out to mothers, educate them about the importance of postnatal care, remind them about coming for postnatal care days. Don't just come back to bring the baby for immunization, but you as a mother also be able to know that there are checkups and healthcare services that you get during postnatal care to help you better raise your child. So as of now, we're working upon ensuring that we can educate mothers. We're creating content, local-based content that can relate to the mothers in developing countries. We're starting with Uganda for now, so the content is targeted to the local people, understand the importance of postnatal care. We send you reminders through your postnatal period, reminding you about each day that you're supposed to come. And in between the postnatal visits, we check in with mothers with like interactive SMS service to be able to identify any life-threatening complications that could be existing that a mother cannot wait till the next visit of the postnatal care day. I believe we were chosen because of the potential of our startup and the ability our startup has to impact the lives of mothers and the people, especially in developing countries. We focus on sub-Saharan Africa. The rest probably the Google Launchpad team could give you why, but on our side we believe we have a startup that has the potential to save a large number of mothers. Following back to the statistic of 1.16 million babies dying, we believe our startup has the potential to save over 600,000 mothers and newborn babies' lives every year. So that's one key we think that really got us into the Launchpad. In the last 3 months that I've been at the Launchpad, we started with understanding our customers. The Launchpad team has really helped us be able to understand how can we talk to the mothers, talk to the hospitals, our target customers. So understanding the challenges and complications. And for example, for the mothers, we wanted to understand why are these mothers not taking up postnatal care services? And learning how to talk to customers was really a challenge. And now we really are confident that we can talk to mothers and understand their problems. And based on that, we have redefined our business model. So as I said earlier, we started as a patient care company. Now we're really focused on postnatal solely, focusing on maternal health as a core service that we want to provide. Through our platform now, we're able to onboard hospitals. Hospitals who use our service can be able to reach out to mothers through an interactive SMS. The term is called telemedicine, whereby through a simple chat with the mother, I can easily know what's happening with the mother. Yes or no questions. How are you doing today? Has the bleeding stopped? What's the color of the baby's skin? So our health team comes up with the questions, put them on the platform, and automate them to be able to chat with the mothers and see what's happening in their lives. To ensure that we create accessibility to our services, we also came up with two more services. One is the microcluster service. So in this concept, we group mothers within a given location to access postnatal care services from a private clinic, so at a subsidized cost. The challenge is sometimes with our healthcare system that we even found out from the mothers, the distance between where they are and where the hospital is quite far. And then the health centers or the clinics in between are a little bit expensive. So at the end, the mother decides not to wait until maybe the next bigger visit. So that's like at the 6th week, missing the most important visits in between. And based on that, we want to be able to, let's group these mothers within a given location, partner with the small health centers, subsidize the postnatal care services for them so that mothers can always be able to access the right service at the right time. Building upon the initial home care service, we want to still now change, instead of just patient care, focus on in-home postnatal care service. Ideally, a mother would be able to request for a health worker from Teheca. Through our platform, they can request for a health worker. This health worker can come do all the services they would have received in a hospital in their home. So this service is really tailored to example mothers who might not be able to really move. For example, a C-section mother, she may not have challenges leaving her home back to the health center, but she needs the service. That's why we're providing this service to her. On the tech side, really, originally we are building for Uganda, and that wasn't really a solution that would easily scale. We have really worked with the Google team and the Google tech guys to ensure that our solution, our platform is scalable, so it can be scaled quickly to other different countries. Those are really our key changes and learnings that we have experienced through the Google Launchpad. That exactly is our core of our business. Our solution is low tech, low cost. Simple SMS. That's like one of the oldest technologies that ever, as soon as the telecom companies came, after the phone call, someone could send an SMS. And that's the core. Through an SMS can reach as far as possible. And we looked, just a survey in Uganda, at least each home now has access to a telephone. Through SMSs, which can easily scale even to the lowest level person deep in the village. And the telemedicine component, really, this is where we're looking at, hoping to have a lot of impact. And actually, we are already experiencing it. Through a set of 5 questions can help us identify if this mother is a high-risk mother, there are likely complications. Should she wait till the next visit or rush to the hospital? So that's where we're, technology-wise, we're using low-cost, low-tech solutions like an SMS. Starting is never really that easy. It's actually, the actual starting is always the bigger challenge than when you've already started. We look back at 2015 when the concept of Teheca started. One of the challenges was actually starting with, are we going to get the health workers to join our team to be able to provide them to the people who need them? We already have a challenge of a high nurse to patient ratio in Uganda. So that was the challenge that we looked at the beginning. For me personally, I believe that most startups, and even I myself as the CEO of Teheca, the challenge that we have experienced was starting with the team. Because without the team, really nothing moves forward. I was lucky to have my co-founder from the day-go. We incepted the idea together. So that was a start. But then 2 people can't run a company. How do you get the next person to bring them on board? Are they the right people? If they are the right people, will you be able to pay them to be on the team? So getting the team right at the beginning was really a challenge. After getting the second person on our team, after my co-founder we participated in a big challenge by UNFPA, and this gave us exposure, credibility, and from there it was really a little bit easier to get people on board. UNFPA was able to help us raise a funding of $10,000, and this was seed fund to allow us really conceptualize our idea and test it out in the market. And so, as I said, team was a big challenge. Then when I talk about funding, I believe funding can always come if you have something that you've already started. And what I would tell most startups really is start with finding the person you work on the idea with. And then if you can get at least the first person to work on the idea with, write it down and at least bounce it off family, bounce it off people you think. For example, for us, we knew we wanted nurses to be as the core of our business. We started bouncing it off nurses. You'd hear what they would say about it. And then, so from knowing what the people who are going to have impact on your business are saying, you get to know whether you should take another step or wait or do more research. Then in Uganda I'll talk about Uganda. One of the most expensive questions they ask startups is, where are you located? Unlike the Silicon Valley is where we see like, I started from the garage. Most houses in Uganda don't even have a garage. So you find that office space is a requirement for you to get your first client, whereas you also need your first client to pay for office space. So I found that as one of the most expensive questions that people always ask me from time to time. But thank God now we will have incubation hubs coming up where we can really be able to start from, work and move forward. I would say my three major challenges starting were getting the team, the funding, and then that expensive question people ask me. Right now we have a team of 5 people. We are very excited about this team really because we have like all the fields we need. We have 2 healthcare administrators, one currently even pursuing a master's degree in public health, called practicing midwife, because now we're focusing on maternal health. Then we have Oliver, who has experience of over 5 years in in-home care, and she has a background in public health. Then we have 2 business people. My co-founder has a business background. She's a CFO. Actually, Asha Namgambe is my co-founder and CFO. And then we have Carol, who before joining us, she was someone who trains other people to start their businesses. So you can imagine such a skill on our team where here we are having someone who trains other people to start businesses. So when we had that team, we're like, yeah, I myself am my full stack software developer, so I bring on the technology component to the company, and I believe we will have a team that can take us next steps. In terms of, I'll talk about the impact we have created with this small team we have now. In the last 3 years to date, we've been able to reach over like 70,000 people within Uganda, and our focus really is within the central region. We started with the central region, and here we've done it we're partnered with hospitals to share our in-home care services. NGOs that work with mothers, we have participated greatly in educating mothers about postnatal care, how to take care of themselves when they're outside of the hospital. We find that when they're in the hospital, they know the nurse will come by, but as soon as they go back home, everything can go really from good to bad quickly. They don't know, what should I do next? Whom do I talk to? They don't have even a close friend who is a nurse. So we give them that friend. We are like an extra family member that each family has by working with us. Our next steps from Launchpad, the 600,000 newborn babies and mothers we are hoping, we really believe our impact is going to be that big annually. We are like shy of 200,000 according to the UN report. We are taking the 600 because really we are still an early stage company, and we believe that we can do much more, probably surpass the already stated numbers. So as I stated earlier about Teheca, a social enterprise, we make money by doing good. And so we have 3 major revenue models. One is we have a product called the Prepared Mama. So in Uganda, for example, for every mother who's going to deliver, there's a set of tools that you have to have as you enter into the labor ward. So we have a product called the Prepared Mama. Probably if someone visited our website, I'll say it. that we sell to mothers so that they can be able to have a safe and clean birth. It's a requirement for every mother to go to hospital. That's one. Our platform, we're selling it as software as a service, where it's managed and deployed. For hospitals that can manage running their own platform, we're able to deploy it for them so that they can ideally be able to keep in touch with their mothers, the mothers that deliver within their hospitals, be able to follow up, be able to send them reminders and do the education part. Because it's important, we find that there's a breakage in between the link between a mother and the hospital. As soon as the mother steps out of your ward, the next time the hospital will hear about them is when they've come back for a postnatal visit. If they don't come, you find there's missing gap. And that's why I believe that by software as a service to these hospitals would be a revenue model to us. And the last one is really the in-home postnatal visits. We're looking at mothers who would request for our in-home postnatal visit from our health workers. So it's a session-based, it's a 2-hour session for a mother. So here we're really looking at giving mothers enough time with a health worker to explore all the challenges they are going through, the questions they want to ask, at the same time get the same checkups they would have gotten in the hospital. So those are our 3 core revenue models. And we really hope to raise fund, though at the moment we are looking at raising at over around 500K to be able to help us move from the validation stage to scaling. And our scale starts from Uganda, then we want to go to Nairobi, Dar es Salaam, and Rwanda. So those are, East Africa is really our first market. And if charity begins at home, we want to be able to impact East Africa as much as we can. And then I believe you can't miss Nigeria when you're talking about Africa. So after East Africa, Nigeria is our next mark.